fairly transparent. And what is expected of you is really there for you to see. It's in what the ANC produces. There are obviously many people when you take your money to tell you the same thing. So I just caution you about that. The fact that a student has gotten into Harvard Medical School doesn't mean that person knows what everyone should look like to be a successful applicant. That one story might have been appropriate for that person only. So there's a lot of misinformation out there, and I think that's unfortunate. Whenever you have a question, you should be talking to someone who does this all the time, whether it's myself or your undergraduate pre-med advisor. These people are here to help guide you. Many undergraduate schools are not very good at working with alums. Others are fabulous at working with alums. For those of you who aren't part of the Health Careers Program, it may be that you simply haven't applied or don't care to apply, that's fine. But you may have resources at your undergraduate school. There are national organizations of advisors that are out there. In fact, the national organization has volunteer advisors to talk to people who don't have access to advisors. You don't have to pay for that. It's something that people do out of just doing good deeds, quite frankly. But certainly you also have us. If you hear Health Careers Program, whether or not you're in the program, we're going to try to answer your questions. Now, how many people know already the distinctions of the medical systems in the United States? There's allopathic and osteopathic. So everybody knows those two terms. I don't know how many people have done research into it or looked into it. There are some differences in the application process. There are certainly some differences in, I think, what they promote in terms of what is medicine, but certainly there are many similarities as well. I just want to talk a little bit about that distinction right now because most people who come to my office are not aware of it, and most people might find that it's a better fit for them, either because of what they're looking for in medicine or what their application looks like, quite frankly. But one of the biggest differences is that what I've been talking about with the grades and MCAT, those are all the same. That's still what's required to apply. But there is a different application for osteopathic schools called a COMAS versus allopathic schools, which is called AMCAS. Now, AMCAS has, they produce a lot of information for everybody, but so does a COMAS as well. The biggest difference in the application, besides that the personal statement for a COMAS is a little bit shorter, is how they handle a course you've already taken. Osteopathic schools in the application, when you take a course over again, the new grade is the only grade that's counted in your GPA. So it is really the application of redemption. It allows you, in essence, to take those very poor science grades from a lifetime ago and recreate a brand new GPA. And they really do look at it that way. They tend, in my opinion, look at an applicant from now and then go backwards to see sort of, what else they've done, where I think AMCAS focuses on the past and goes forward. And this is important when your undergraduate GPA is not competitive. If that's where they're starting, they may never look at anything else. And with the COMAS, they're looking at what are you doing now, and if they like you, they can go back and say, well, that's still good enough for us. So it's kind of a different attitude. AMCAS and the allopathic schools certainly don't prevent you from retaking a course, but one of the things that they do is they just average them. And so it's much harder to have an impact. And I think even beyond that, there's sort of a sense of, okay, you took the course again, you did better, so what? You've taken it before, shouldn't you have done better? What did you prove to me? So it kind of even works, I think, in not only as an average, but I think it actually is then negatively viewed in the sense of, like, what did you show me? Big deal. So it is more difficult to redeem yourself for allopathic school than for osteopathic school. There are clearly differences in the medical training. Osteopathic medicine does believe in a more, what I would say, almost chiropractic modality of treatment as part of what they do. Of course, chiropractors would certainly disagree with me, and osteopaths would disagree with that statement as well. I think what they're doing is quite different. It's manipulation, and from an outsider looking in, it's the simplest way of thinking about it. But they also do all of the other things as well. They do get trained in all the other things. They write out prescriptions, and they treat everything from do surgery, etc. So it's not simply, it's licensing is much the same in the United States for both. There are some differences internationally where osteopathic doctors are not recognized in some countries. Particularly that's true in Europe, because osteopathic medicine has a very different meaning in Europe. It was much more aligned with homeopathy, which is clearly not sort of modern Western medicine. It's a little bit more alternative medicine. So it's sort of still thought that way when you get over to Europe. So one of the things that I want to just mention, and then I'm certainly going to come up with questions and things like that, but is to try to, at this point in time, when it's still early and the application is kind of off there, is try to talk about some of the things that are common mistakes that are made year in and year out. The application at many schools is rolling. So it's kind of first come, first served. The AMCAS application begins accepting input usually in May at some point. And then they allow you to actually hit apply somewhere in the first few days of June. Now, what happens when they get an application is they're going to begin a process that's called verification. Verification is looking through the typed transcripts that you have recreated. That means you have listed every course ever taken or attempted at the undergraduate level or graduate level. You just keep typing them all in and you're coding them. This is biology, this is chemistry, this is English, this is whatever, other. And then they're going to get your official transcripts that you have had sent directly to them, and they're going to make those comparisons and see if you've done that correctly. That's called verification. This year, verification by August was taking up to 9 weeks. That's the longest I've heard in many, 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 many years. They will tell you it's 4 to 8 weeks, but last year they were much better at getting this done. This year, for whatever reason, many students had 9, given 10-week verification times. If you apply in June, the verification tends to take more like 4 weeks. So right away, you can be verified quicker if you apply earlier. Now, during this process that's running in the background, okay, there is another step where AMCAS tells the medical school that you've applied. Now, they won't do that at all until the last Friday of June. So I know of people who stay up at 12:01 a.m. on that first night and try to do it, and that's when the computers crash. The only thing you're going to be is frustrated. So I don't tell anybody to apply on day 1. Let the goobers do that. Wait till day 2 if you really intend to stay, or day 3. You're not going to lose a step by doing that. Applying anytime in June, that's golden. But after June, this year was June 29th, okay, that's when they released all the information. If you had applied earlier, no one knew that you applied. After June 29th, then the schools get told that you've applied. Medical schools are ordered to send you individual secondary applications. Secondary applications are the individual application, like, why us? Why do you think you belong at our school? Certainly they'll be asking that. And they're also going to be asking for money. And on average, I think it's about $85 per school at this point for a secondary application. Now, AMCAS, of course, also has a cost. I think it's $185, $165, I think something like that. And that allows you to apply to one school. Every school you add to that is $30. A lot of applicants apply to 20 to 30 schools. That's pretty normal at this point, 20 to 30 schools. I've had applicants apply to more. I've had applicants try to apply to all of them. I don't quite understand that, because I don't know how you can justify that you belong at all of these different make sense of it. But anyway, a lot of students apply to 20 to 30 schools. So AMCAS is $1,000, and then there's another roughly a couple $1,000 in secondary applications. And of course, if you're lucky, you can be offered an interview, you have to get to these places as well. So applying to medical school can be insanely expensive, and you have to consider that when you start choosing your schools. When I see a student apply everywhere around the country, I start asking them about how to get into all these places. That's an important question. I've had students who had interviews they couldn't afford to get to. And I think it's a shame, but it's just a reality. The other thing to consider is the list of schools. There are private schools and there are public schools, what we call state schools. And for the most part, unless you're a resident of the state, you should not be applying to their school. Now, in some instances, it's absolute. At UMass, you cannot apply unless you're a resident. And the residency at UMass Medical School is unique in that it requires 5 years in state. And being an undergraduate, you can't count those 5 years. In other words, they don't start while you're an undergrad. As a postbac, you can establish residency if you're here long enough, but it takes 5 years. The exception is if you grew up and went to high school, you could have moved away and come back, and you'd still be counted as a resident. At most states, it requires 1 year to be a resident. Yes.
Is it 5 years by the time you have started attending?
No, by application, it's not matriculation. And so it's absolute, you must be a